Good morning and welcome to my COVID-19 World Update for today, June 30th, 2020. We're going to start off taking a look at various charts from around the world and doing a little bit of a comparison for them. This first one is for the country of Australia, and this is daily new cases, and it's a linear chart, and this is just looking at the last 30 days. Now you can see in Australia, while their most recent case count was 80 cases in a day, that's quite low. It's actually lower than the state that I live in. The state that I live in is one of the lowest in the United States. So in and of itself, 80 cases reported in a day in Australia is not a concern. But I guess what would have been the concern was that Australia was trending down towards zero, which is something that New Zealand achieved, for example. But then they've started to have a steady rise back up again, and currently they're on a pretty significant increase. Now, from what I've been given to understand, a lot of these cases are cases that have imported. In other words, people coming home to New Zealand from abroad who have the infection. Australia has been pretty strict about putting people on quarantine in order to avoid new spread. But if this is getting out, it's obviously not community spread yet, but it is of concern, and they definitely need to stay on top of this. We'll keep watching Australia. They've been one of the success stories thus far. Now this next one then is a comparison between Australia and Japan. So that's the same 30 days, shows the same trend in Australia. And you can see that a similar trend is happening in Japan as well. Obviously in this little blip here, they didn't report that day and then added the cases on that day, which explains why that went up so much. But you can also see that Japan is going along pretty well, but has definitely hit an upward trend now. And again, you're only looking at maybe 120, 130 cases in all of Japan in a day, which is not terrible, but you can see that the trend is upward, so it's worrisome. And I'm sure the officials there are on top of it. I think Japan and Australia probably have maybe the best chance of coming through this relatively unscathed. They might actually make it to the vaccine. Next we compare, we add the Philippines to this. So whereas this chart had Japan on the same scale as Australia, this one now adds the Philippines, and the scale has increased where Japan's cases down here at 150 are compared to the Philippines that are up here at about 1,000 cases a day. And you can again very clearly see where you had a good lockdown in the Philippines until about mid-June, and then you can see where they let up that the cases have started climbing again. And at 1,000 cases a day, it's starting to get to the point where it's worrisome, especially considering the lower amount of testing that goes on in the Philippines and the lower access to medical care that many of the people who live there have. And here now we compare the Philippines, same time frame, but now we're comparing the Philippines against Sweden. Now Sweden has been controversial in its coronavirus response from the beginning, in that they effectively had no countermeasures to the virus. They just let it go. Sweden, I think, benefited from being at the end of the line as far as the stream of the virus goes, as it disseminated out into countries. Sweden is relatively remote, so just by curtailing air travel, they went a long way to curtailing the spread of the virus. But they're definitely on an uptrend, and I think I might even say that in the second half of June they've got a little bit of an acceleration there, as we have been seeing in some of the other countries. So that's a concern in Sweden. Sweden's not that popular as a country, so 1,200 cases in Sweden is not nothing. So here now we've brought on the UK, and this is something of a success story if they can continue this trend, because you can clearly see that in the UK they've had a significant downward trend as they were in their lockdown. They have begun to ease the lockdown, so the downward trend has slowed as far as reducing cases, but they're still on the downward trend, and they've been surpassed by Sweden in the new cases on a daily basis. So the UK has been doing a good job. Let's hope they're able to continue that and keep the cases going down. Now I left Sweden on here to compare Sweden against Indonesia. Indonesia is another country that has been seeing some significant increases of cases. Indonesia has a relatively good medical system if you can access it, similar to, say, India and the Philippines. And so reported cases versus actual cases, there's probably many, many more actual cases than what are being reported. But as you look at this, you can see a good similarity between Sweden's chart and Indonesia's chart, which makes me think that practically speaking, it's very difficult for Indonesia to truly shut down and halt the spread in that manner. Now here we have Indonesia again, but this time being compared to Mexico across that same 30-day period. And you can see that Mexico has had quite a bit of increase over the last 30 days in their case counts. And considering the thought that Mexico is less populated than Indonesia, there's lower population in Mexico than Indonesia, their case counts are quite high. There is a bit of encouraging news in that little short-term downtrend in the last few days in Mexico. We will need to see if that continues. On this particular chart, I showed a 7-day rolling average to smooth the lines a little bit, make it easier to look at. But three downward days in a row, it's something. But I'd rather see about 6 if I'm gonna call it as a trend that Mexico's got something under control. And then here we compare Mexico against India, and again, looking at these slides, you can see that Mexico is about 5,000 there, and on this next one, 5,000 is down here. So we're changing the scale as we go in order to put the countries on as a comparison. And India has definitely got a steeper slope to their daily case count. This is of concern. That 2 days of downturn doesn't really mean much to me because they had a couple days downturn here, they had a couple days downturn here. So that's more of a periodical thing that's going on. It's probably that 7-day bump is what we're looking at there. So India, because of the way their medical system is, it is a good medical system overall. Access to medical care may be difficult for many people. The Indian hospitals, in many cases, are being overrun with patients, and so there most certainly are patients dying in their homes or just simply being sick in their homes and not being treated. They'll either survive or they won't survive, which makes it a difficult situation. In my mind, I have no doubt that India will end up being the country that is most affected in total deaths by this virus as the time goes forward, both because of the inability of the medical system there to care for all of the people who are sick, and also because of the effect that this disease has on those who have darker complexions. And in India, much, in fact, the majority of the population has a very, very dark complexion. And that links back to the vitamin D thing again. I did a video on that you can look up. So now we compare India with Brazil, and Brazil is leading India both in case count per day, but if you also take a look at the slope of the lines that are the daily case count, you can see that the virus is also growing faster in Brazil, is becoming more endemic in the population as the days go by. So not good for Brazil. You can see that nothing that they have done, which is very little, truth be told. Brazil's government has done very little to try to combat this virus. Their efforts have been pretty weak, and it shows in their numbers that it's spreading and spreading very fast. And then we add to that the United States, and if the government in Brazil has done a poor job to slow the spread, the government of the United States has done an even poorer job. You can see that in the increase in the cases over the last 14 days or so. The U.S. slope has definitely gone up during the lockdown. We were holding pretty steady in the U.S., but on or about mid-June, the cases really started increasing, whether that's because of relaxation of lockdown measures or because of the thousands and thousands and thousands of people who were in the streets shouting and screaming in close proximity to each other. We can see that the case count in the United States is climbing, and it's climbing at an accelerated rate. And in that respect, the U.S. leads the world. Not a good place to lead the world for sure. Now, on this slide, what I've put in is the daily new confirmed cases, and I included all of the countries that we've spoken about thus far, and I kept it on a linear scale. And the reason why I did that, even though it gets these countries down here jumbled up pretty good, is because it gives a decent idea of just what the scale is between the various countries and the effect that the virus is having in those countries. Now, one thing that I will say for the U.S. is that we're doing a lot of testing in the U.S. If you overlaid onto this chart the amount of testing that is getting done in the U.S. versus other countries, we'd also be the world leader in testing. So you test more, you get more cases. That's just a given. And hopefully that'll show in the end when we see what our mortality rate is from the virus. Hopefully we'll find that we're getting to the cases sooner and being able to treat people, because there are now some therapeutics out there that are helping reduce the severity of the disease. So the sooner we find a case, the quicker we'll be able to get some treatment to those people and help them have a less severe case of the illness. Now, this is the same list of countries, the same time frame. It's also a linear scale. And what I've done here is just overlay cases per million. So this here is cases per day for each one of these countries. And this one here is new cases per million population per day. So you can see some things changed around a little bit there. And this is, for example, the problem that Brazil has, because per population, they're way out in front with regards to how many people in Brazil have had the illness. And Sweden, per unit or per capita, also leads the United States in this regard. So it's worrisome for those countries that show up high here, because it means they're going to have a lot more cases, and just playing the percentages, that also means that they're going to have more deaths. Some of the others, it's nice to see the slope heading down a little bit in Mexico. All of these countries, the UK, also seeing the slope going down. That's a good sign. Anytime you see the slope going down in cases per million daily reported, that means that you're starting to control the spread, which is a good thing. Now, this one then is essentially calling out what is the death rate in the various countries per million. These are, again, the same countries that were on the prior slide, but what we're looking at here is the mortality rate for the disease. And again, for some reason, they've switched to deaths per million. Typical and standard would be deaths per 100,000. And so I've discussed in the past that a bad flu year in the U.S. is right around 200 deaths per million. When Italy was the focus of attention, I was able to establish that 400 deaths per million was the worst flu year that Italy has seen in the last decade. So this gives a bit of a comparison to understand just how deadly this virus is. So in the United States, what we're running right now is approaching twice as deadly as a really bad flu year. And considering all of the lockdown measures and the things that have been done to try to curtail the spread, that's not a good thing. But I guess it's good. Whatever we do, I guess it's a good thing in that it does reduce it a bit. But at any of these countries that are above 400 deaths per million people, That's pretty significant and serious and difficult. And you can see that Sweden is in that club now as well. And all of these slopes that are increasing, I guess they're always going to increase. The best you can do on this slope is be dead level, like Norway, Philippines, Indonesia. So that's what you're looking for is to keep these lines level. Thank you very much for watching today. I hope that if you like this update, you'll subscribe to my channel. And as always, wash your hands with soap and water. That's the best way to deactivate the virus particles. If you don't have access to soap and water, use hand sanitizer with at least 60% alcohol in it. Wear a face covering in public spaces. Wear a mask. Get used to wearing a mask, even if you can only wear it for 20 minutes at a time while you go into the grocery store. Do it. It can help you, and if you're infected, it will help others. If you care about the lives of other people at all, wear a face covering when you're in public spaces, when you can't social distance, and tell your friends to do the same. Thanks very much.